Good evening, and thank you for joining us. I am Ellis Dean, Director of Digital Programming and Production here at BlackDoctor.org. I'm going to share some remarkable news. Last year, we broadcasted approximately 2,000 programs that reached 9.5 million people. We did shows about COVID and cancer, heart disease, diabetes, Alzheimer's, all types of eye conditions, and mental health. Yes, we talked about a variety of conditions that impacted communities of color negatively. All of those programs touching all of those lives, and yet not one program about tonight's topic. Tonight, we're talking about cytomegalovirus, or CMV. I know. You don't want to hear about another virus, but stick with us. You might just save a life. Tonight, we're going to learn what is CMV. We're going to learn why should we know about it, especially if you're a woman of childbearing age. And most importantly, we're going to learn what you can do about it. But before we begin, let's take care of some housekeeping items first. Let us know where you're watching from. We like to know where all of you are watching us from all over the world, so give your city a shout out. I'm in the capital of the South, also known as Atlanta, Georgia, so I especially want to hear from my ATLians out there. Second, we ask that you like and share this program. Also tag a friend who you know could use this information. Finally, if you have any questions, please drop them in the comments and we'll get them asked and answered. Are you ready to meet the panelists? Good, let's go. First, we have Dr. Owen Garrick. Dr. Garrick is Chief Medical Officer of CVS Health Clinical Trial Services. In this role, he is responsible for the overall medical strategy across the portfolio, overseeing medical compliance, clinical insights, publications, and clinical innovation. Dr. Garrick is a nationally recognized leader in the field of research and research ethics. He was confirmed and completed a term Department of Health and Human Services Advisory Council on Human Research Protections from 2012 to 2016. Dr. Garrick earned his MD from Yale University School of Medicine and his MBA from Wharton School of Business. He holds an AB in psychology from Princeton University. Next, we have Dr. Monique McKnight. Dr. McKnight is a board-certified obstetrician and gynecologist at the Center for Children and Women, Greenspoint. Dr. McKnight training from the Morehouse School of Medicine and went on to complete her OBGYN residency at the University of Texas Medical Branch. Our third panelist is Dr. April Spencer. Dr. Spencer is a board-certified obstetrician and gynecologist at the Center for Children and Women, Greenspoint. Dr. McKnight, oh, wow, what happened? All right, sorry. Dr. Spencer, I apologize for that.
No worries.
So Dr. Spencer is a surgeon, and we'll get more about that. I'm sorry about that, Dr. Spencer.
No problem.
Finally, we have Dr. Samira Brown. Dr. Brown is a board-certified primary care pediatrician. Dr. Brown's love of working with children led her to pediatrics, and throughout her career, she has been a passionate advocate for patients and families. Her philosophy is that every child and family should receive high quality and equitable care. Dr. Brown is a proud alumni of Xavier University of Louisiana and Harvard Medical School. Dr. Brown became medical director of both her primary care clinic and newborn nursery, focusing on childhood obesity, breastfeeding, promotion, and quality of care. She has over 10 years of clinical experience caring for children of all ages and has lectured both nationally and internationally. Good evening to you all and welcome to the program. Dr. Brown, let's start with you. What is CMV?
So certainly thank you for having us. This is such an important topic and, good to really talk about CMV. And you're right. The first question is just, what is it, right? And so it's a virus, right, that can infect anybody of any age, right? And it's not uncommon. About half or a little bit more of adults have had CMV at some point in their life. And by the time kids are 5, usually 1 in 3 kids has had a CMV infection. But if you have a normal immune system, right, and you're older, you're not, a newborn baby, typically you can have either no symptoms at all or very mild symptoms, right? And so if you do have symptoms, oftentimes it's a mono-like illness, right? So you can be very tired, you can have a sore throat, fever, But typically, you're going to get better slowly on your own. But for babies who are growing in utero and babies who are newborn, also those with weakened immune systems, it can be very severe, even life-threatening.
So, are there some symptoms associated with it, or is it just something that we just get exposed to it and it's in our bodies?
So certainly when you get exposed to it, you may not have any symptoms at all, or you can have those, mono-like, symptoms that we talked about with sore throat. You can have, swollen glands in the neck. Sometimes the liver, the spleen can get a little enlarged, right? And typically kids do come in with fever and sore throat. It's not strep, right? And typically we can do blood work to test for, CMV. It's one of the viruses that can cause that mono-like illness. So most folks who are healthy can have symptoms like that, but a lot of folks have no symptoms at all. But certainly the virus can still be transmitted even if you've never had any symptoms. And any bodily fluid can pass CMV. So it can be in saliva, it can be in breast milk, it can be in vaginal fluids, semen, blood, right? So any contact with bodily fluids can potentially pass it. And some folks have that virus in their fluids for months after an infection, even if they never knew they got infected. But for babies who are infected during the pregnancy or very close after, oftentimes they can have very severe infections. It can infect their skin. So sometimes they have rashes. It can infect their brain. So it can cause calcifications, developmental delays with cerebral palsy. They can have hearing loss, and it can infect the retina of the eye, their lungs, their liver, really just about any, system it can infect and cause, long-term, pretty debilitating symptoms.
Wow. Okay. All right. So, trying to just wrap my head around CMV, but now you're bringing up a good point when we're talking about all those different ways and all those different areas and all those different fluids that CMV can kind of hide in. So that says it seems to me like it's going to be very contagious or passable to somebody else. Um, so let's turn to Dr. Monique. That makes it a unique situation. If it is passable, then it should be able to be passed from a mother to their unborn child. Because if mom has CMV in her system, we know everything that mom has goes to that unborn child. It's a condition, I believe, I was doing my research and it said congenital CMV. So what is congenital CMV?
Well, congenital CMV basically is when the virus is present at birth, and that can be via vertical transmission of the mother. Once the mother gets infected, it can go, like you said, to the placenta, and then from the placenta infect the fetus. And also, that's the most common way to acquire congenital. Very rarely, you also can have a postnatal infection where, just like Dr. Brown talked about, the virus can hide in the vaginal fluids, and the virus can also hide in breast milk, and it can be passed in that manner as well. So it's simply when the virus is present at birth. It's what congenital CMV is.
So if a mother contracts CMV, is it automatic that she'll pass it to her unborn child, or is it just we don't know if it's not a 1-to-1 ratio on that?
No, it's not automatic, but what we do know is that the further along the pregnancy is, when the patient does become infected, the more common and more frequent that the fetus can become infected. So, for example, if you have a mom who's in her first trimester and she becomes infected, you have about a 30 to 40% chance of the fetus becoming infected. But if you have a mom in the third trimester and she becomes infected, then you have more of a 60 to 70% chance of the fetus becoming infected. So not all moms are automatically going to transmit to the babies, but the frequency does increase as the gestational age increases. So with that being said, the mothers will who have transmitted it early on will actually have babies that have more severe symptomatic CMV versus the
Okay.
mothers who pass it on in third trimester will have less severe CMV symptoms.
So Dr. Brown, so if a child is born with CMV, what impact does that have on that child's development?
Yeah, so a lot of times these children can have hearing loss. Even if their hearing screen is normal at birth, we continue to screen them very frequently because it can develop in the first couple years of life. And certainly that could impact, especially their speech development. And then certainly if they have eye involvement, brain involvement, lung involvement, there can be many other, kind of systems that get involved if they're infected. And not all, CMV infected babies are the same. So typically we do a very thorough workup, and those babies who are symptomatic, there is antiviral treatment that you can start to try to mitigate, some of these symptoms. And typically they're going to see not only their pediatrician, but also an infectious disease doctor. And typically we get early intervention, involved very quickly to make sure that we give them all the supports that they can.
So, Dr. Spencer, again, my apologies. So I'm going to kind of let everybody know who you are. So, Dr. Spencer is a board-certified surgeon. She's founder and chief operating surgeon of Dr. Spencer's Global Breast Health and Wellness Center. She completed general surgery residency at Morehouse School of Medicine and a breast surgery fellowship at MD Anderson Cancer Center. So, again, welcome to the program, Dr. Spencer. We know whenever we're talking about a condition that, especially when we're talking about, children, childbirth, women's health in particular, and women of color, there are some disparities that that come into play. And that's an unfortunate kind of side effect of healthcare. We're working daily to eliminate disparities, but right now they still do exist. What could be some of the potential disparities that Black women or women of color experience that contract CMV with regards to testing their child to make sure that the child is healthy? You're on mute. You're on mute, Dr. Spencer.
About that. That's a great question. Again, thanks for having me. As a breast surgeon, I see firsthand a lot of disparities that happen amongst African-American women, or just women in color in our healthcare system. There's a lot of implicit and conscious and unconscious bias. And as it relates to cytomegalovirus, we had some recent data from the CDC that showed that Black women are about 3 times more likely to have a maternal death than non-Black women. The CDC also recently reported that the maternal mortality rate on average in the United States is 17 per 100,000, but it's 43 per 100,000 for African American women, just to give you all perspective on how profound this is. I also see some disparities even with breast cancer, with it being a mortality rate about 40% higher than non-African Americans, even though the incidence is lower. And so the reason why this is extremely important in terms of being able to diagnose, treat, and just having access. A lot of African American women, it's a lack of access, number one. A lot of times it's a lack of education or being aware that cytomegalovirus exists and some of the sequelae involved. Like Dr. Brown, Dr. McKnight just mentioned hearing loss. And a lot of our children are experiencing hearing loss because the mother just didn't know to get tested for CMV or to have the child tested for CMV. And so I'm so glad that we're having this discussion tonight, because I'm a huge advocate of going from education to inspiration. So we're educating people tonight. They can be inspired to have these conversations with their doctor during their maternal visit, or have their discussions with someone like Dr. Brown during their pediatric visit about things that they can do to be proactive if they are pregnant or thinking about getting pregnant, to protect themselves against CMV, and also be aware of what to look for with the congenital or transmission of CMV, and things that they can do to treat the virus, because a lot of this is very preventable. But if we don't have conversations about it, our women will continue to have this disparity. So I think education is a big part of that.
Dr. Monique, when mother that's pregnant comes to your office, are you automatically testing for CMV? Is that something that automatically gets done? Or is that something that says, oh, I've had mono in my past, I've had chicken pox, so you know they've been exposed to the CMV? How does that work?
Right now, we don't do any routine screening for pregnant women for CMV. It's not recommended based on our ACOG guidelines. But what we do is we will screen them per their symptoms. So if they have, like Dr. Brown said, monotype symptoms or flu-like symptoms that we are not able to find a cause for, we do check for CMV, or if they come in with a rash or just something that is not very inconclusive with the other studies, we'll do CMV testing for those. But as of right now, it's not recommended to routinely test all pregnant mothers for it.
Dr. Brown, there's a great question in the comments from Joyce. And Joyce is asking, can CMV cause autism?
So not that we know of. Certainly it can cause developmental delays, but not autism specifically. That's a great question.
And is CMV a new virus? That's another question that came in the comments. Is it a new virus?
No, CMV is not a new virus. I think what's happening is that with the advent of COVID-19 coupled with social media, we just have a broader way to communicate. And so now you can get information, whether it's Facebook or Twitter or Instagram. We have become just this, we're all global citizens. So we're talking about these viruses more, and we have access to people all over the world now. But no, it's not new. We've been aware of it for a very long time. We just have platforms in which we can have these discussions. And then people are a lot more mobile. Right. And so we aren't just relegated to our communities and to our neighborhoods. We have planes and trains and people travel. So we are oftentimes exposing ourselves to viruses outside our community, unlike we have ever done before. But again, that's a great question.
And I'll just add quickly to that. The other thing that's happening is we can actually begin to do something about the virus, right? So the benefit of all the funding, resources, smart people that went into developing the COVID vaccines, we leverage that technology now for many, many other viruses. So since we are beginning to develop therapies, you're going to hear much more about viruses that we couldn't really do anything about in the past.
Well, that's a good question. That's a great segue, Dr. Garrett. I was going to ask you, what is CVS-H? What is CVS Health? What is a community site network, and what are they doing? What is CVS doing to lend their weight and their hand in the fight against these kind of viruses like CMV?
Sure. So most people know CVS as your retail drugstore. There are almost a little under 10,000 across the country. And within many of them, about 1,200 of them have minute clinics. So these urgent care centers that you can come in for treatment. And we're converting many of the minute clinic locations to research sites. So they are located within diverse neighborhoods, walking distance often, and where you shop and pick up prescriptions and get healthcare otherwise, versus going to large academic medical centers. You can stay within your community and participate in a clinical trial, in addition to getting a broader healthcare. So we have roughly 80 of these locations across the country now. The business started about 2 years ago within CVS. So we built up a fair amount. And what we decided, and this wasn't an afterthought, oftentimes when we think about people of color, we're an afterthought, but we had a clear and initial focus on putting these research sites in communities of color. So you'll hear us and you'll see that we have locations in places like Atlanta, Savannah, Charlotte, Chicago, Dallas, all throughout Florida and Southern California, where you have large pockets of people of color. So in short, the ability to come in and participate in a location that's accessible to you in terms of clinical trials.
And why is it important to have more people of color involved in clinical trials?
Sure. So the basic idea, and I'll spare you all the statistics, right? The basic idea is you study a small group and you could extend those results to the larger population. So we got almost 400 million people in the US. You can't study 400 million people all at once. So you study a small group, and you can apply those results from that small group to the larger, to everyone, when that group, that small population in the study or clinical trial represents. So there are old people, young people, people from New York, Chicago, men, women, people of color, people that have some diseases that don't have, right? So Mets fans, Yankees fans, I imagine Cowboys fans too are allowed. So you have a very diverse
No
group,
Cowboys fans. Nope, no
right?
Cowboys fans. Yes.
A diverse group that reflects America, and then you can apply those results. So you can say very effectively that this vaccine, this new type 2 diabetes medication, this new lupus medication works in people of color because we studied it in people of color from the beginning. So that's the real importance. And the other part is, if you look at one of the issues around health disparities, is if you give someone the same therapy, the entire population, there'll be some groups that have a differential response, which means a drug or new therapy might not work as effectively or as well in them, right? And so you can't know that unless you study it within that population. And then once you know that, you can optimize a drug, right? So make it better. Maybe you give more or less of a dose. But if you're not studying diverse populations, you can't, one, know if it works as well, and then make those tweaks if you're finding that it's not.
So how is CVS is like this focus on local communities? What type of impact is it having on those communities, particularly that, as you mentioned, communities that are typically underserved or don't have as
Right.
much access to healthcare or medical facilities that's close to them?
Yeah, we are finding that more people of color are participating in clinical trials because you have that convenience. The other part is, if you come into a CVS, you'll see that the staff looks like the community that it serves and it's part of, and that's because it is, and it does, right? So, and that's the same with the research staff, our principal investigators or doctors that are overseeing the study, the nurses or PAs that are interacting with the patients, the research coordinators. We've made a concerted effort for the staff to reflect and be part of the community. So that supports the issue and helps with the issue of trust that people of color have with the medical community, because they know that the people that are serving them are part of the community. So those are some, just as I mentioned earlier, not an afterthought. We have been very intentional about our approach, how we're going to build this research enterprise within CVS Health to really serve and be part of the community.
So for some of the physicians, we'll start with you, Dr. Spencer. Do you stay abreast of what trials are available, and if you have somebody that comes to you that have breast cancer or might be developing breast cancer, do you steer them to a trial? Do you find that patients are asking more about trials, particularly patients of color? How is that process going in terms of referring people to trials?
Yeah, I love the fact that you actually do stay abreast of CVS.
No pun intended. I'm
Yes,
sorry.
sir. No pun intended. But yes, I definitely try to do that. But we've got to help put patients back in the driver's seat of their health. So although I oftentimes will initiate the conversation, when patients initiate it is often when they have unfortunately presented with a very advanced breast cancer. And we certainly saw that after COVID. We had a lot of progression of disease in a lot of patients because, quite frankly, in the interest of conserving resources, a lot of the imaging centers and surgical centers had to defer these surgeries until later. A lot of these women still got treated. But now clinical trials is something that we had conversations about, like, okay, you can't have your surgery now, but there's a clinical trial at this specific location. I think you might be a really good candidate for. And then it was also important to help patients understand that clinical trials, as relates to breast cancer, any illness or disease, is to just make sure drugs are working more effectively in all populations. Like you mentioned before, like you have some populations of women or men that don't respond as well. And so you'll have a patient, for example, may say, I've been taking this medication, but my cancer came back. I have a recurrence. Okay, you can get involved with this clinical trial, but please encourage your family members and friends that may qualify to get engaged in clinical trials so that drugs can work more effectively. So we don't have to change the medication or put you on a clinical trial just to see if a drug will be more effective. So I think we are definitely having more conversations, and patients are beginning to ask about the clinical trials, but unfortunately, again, it's in the setting of advanced disease. So we've got to encourage our colleagues in medicine to have these conversations. What I typically do is I collaborate with the medical oncologist, and I'll ask, what clinical trials are out there, have a patient that has triple negative breast cancer or breast cancer that's absent of the 3 main receptors that we treat, or have a patient that has metastatic breast cancer, which is breast cancer that has spread to organs outside of the breast that may qualify for a clinical trial. Or we have patients that may have early stage breast cancer that can also qualify for clinical trials. So it's just having more of a collaborative approach, a community approach, and picking up the phone and chatting with your local GYN, medical oncologist, radiation oncologist about what's available, and also having these conversations so patients can know to ask about clinical trials and get resources about where they can inquire about having more information about any clinical trial that they or the family member may qualify for.
Dr. Garrick, I was sitting here and I hear you talking, and I was like, wow, one, I have a CVS right here. I live in, Midtown Atlanta, and I've got a CVS I can literally walk to. So it's right there. And I went there and I got my COVID booster there, and I go there. So I'm feeling you when you're talking about it's right there in the community, right? I don't have to go to sign up for an urgent care center. And but that extra step, those minute clinics, I think that's that next step that what you all are doing in terms of going from, I can ask my pharmacist about this medication, but now I've got a staff member, I've got a whole clinic that I can lean into that's right there in my community. I don't have to travel far, and it's got people that I trust. Is that what's happening there, and you're seeing that kind of change in the communities that you're serving around the country?
Yes, most certainly. And certainly, first, appreciate you supporting the business. They pay us in stock. So please keep going in so you can keep me employed here. And you're spot on. CVS Health is moving toward becoming more and more of a healthcare company, right? So if you think almost 10 years ago now, CVS stopped selling cigarettes, right? And has really thought through, how do we become more of a healthcare company? How do we expand into primary care, into research? And you're right, we're not on every single block, but we're on a bunch of them. So you have the ability to go into readily accessible locations. The other thing we did with this study, specifically, we developed a pilot with Uber, where you can actually get rides at no charge to and from your study visits. So we want to think through, how do we make it as easy and as convenient as possible for the patient? So this, you hear this all the time, this patient-centric approach, right? But really understanding what are the challenges that patients have. The other thing is, you can come outside of the 9 to 5. So the site locations, Minute Clinic in particular, and our research sites are open after 5 o'clock.
Right.
We're open on Saturday as well as Sunday. So you can schedule a visit that is convenient for you. I will say, if you go to church on Sunday, don't let me get you in trouble with the Lord. Please go to service and come afterwards or before, but you can come and get your research visit on a Sunday. And you don't got to worry about taking off from work or traveling during rush hour.
That's fantastic. So, Dr. Brown, there's another question coming from our comments. When CME, when it does cause speech delay, will the child ever be able to talk, or is that speech delay permanent?
So, it just depends, right? So it depends on how severe it can be. It can be anywhere from mild to severe. So that's why we continue to screen for it, to pick up for it. And then as long as they get into speech therapy early, a lot of times you can mitigate, what happens with that. And so whether they, need devices to help them hear, help them communicate, all of that can be put into place. And the earlier you do it, the better the outcomes are for children. So if, even if you're not sure about CMV, if you have a child that you feel like they don't really hear you that well, or they need things, turned up, babies, if they're not responding to your voice and to certain sounds, you certainly want to call your pediatrician. And it's easy for us to get a screen. Sometimes they do end up seeing an audiologist, but typically with speech therapy, your outcomes can still be very good. And of course, kids usually can learn to communicate and talk.
Well, that's good. That's good. So I hope the person heard that and got the information that they needed. So CMV, really, I mean, this is. I promise you, I was today years old when I found out about CMV. Almost like you see those memes on Facebook, and so like now I'm like, oh, I'm worried, particularly for women that are childbirthing age. And so, Dr. Monique, is there something that women can be doing now to protect themselves? How should women that are wanting to get pregnant or are currently pregnant to protect themselves from contracting CMV?
That's a good question. The best thing that they can do is practice good hand hygiene. Try their best not to interact with small children that are they are the most common carriers of CMV. Don't drink after them. Don't eat after them. Make sure that they wash hands after close contact with young kids. Um, and then, of course, just be very diligent about their sexual health, protecting themselves accordingly, and understanding the symptoms that they could, sometimes they do have symptoms that can present, and being able to quickly call the OB-GYN or their doctor to get tested for CMV. It's the best thing that they can do to help prevent and or catch an early phase of it.
Okay, good. So wash your hands, take care of yourself, always. So Dr. Garrick, we're talking about clinical trials. We're talking about CVS. I'm hearing that there's a clinical trial ongoing at CVS that's trying to combat CMV. Tell us more about that clinical trial that's going on right now.
Sure. So we are in fact conducting a clinical trial. It's called very creative. We spent a whole lot of money on this, the CM Victory study. Yeah, we are conducting it at 7 of our locations in Georgia, 6 in and around Atlanta, and then 1 in Savannah. So you have, but the study is actually going on. Those are just at those are the 7 of our research sites. It's going on across the country. And you see the website there, learnaboutcmvtrial.com, to get much more detailed information. And like I mentioned, it's not just our locations in Atlanta and Savannah, but locations across the country where you can participate. But you can go to this website here and learn more about the study, who might qualify. It's what we call inclusion criteria. These are things that get you into the study. Then you will also hear something called exclusion criteria. So what keeps you out of a study? The inclusion criteria in this case is pretty broad. You mentioned women of childbearing age, and very specifically that's 16 to 40. You can't be currently, so that's an inclusion criteria, not currently pregnant. So that would be an exclusion criteria. And in generally good health, you're not to be perfectly healthy, but you can have a few things going, but generally good health. So those are the broad criteria. The website will provide more information for you. There's actually it will lead you to what we call a screening tool. So you'll answer some questions to see if you actually qualify for the study. And then if you do, your information will be sent to one of the local sites, and that site will follow up with you to give you even more information about. You'll often hear this term risks and benefits of participating. So what you get out of a study and also what you need to be concerned about.
Well, that is fantastic. So just really, we're talking about really saving lives, changing lives, and protecting. So we need women of color to participate in these clinical trials. Go see if you're a woman of childbearing age, or you're watching this program, or if you know somebody that is of childbearing age and wants to have a child, say, hey, look, they're doing a great study about CMV. Have you ever heard about this? Right. So now that's why we spent so much time telling you about CMV, because I'm sure if you were like me, you're just finding out about CMV right now and the impact it could potentially have on a child that you might want to have. And so I think it's important and then this is a nice kind of introduction into getting involved in clinical trials. And so go and see. And if you don't qualify, at least you tried, and you could send somebody else, somebody that you know. Dr. Garrick, I see you want to add on to that?
Yeah, and if you don't, the website there is set up. If you don't qualify for this particular study, it will give us an opportunity to inform you about other studies and continue to engage with you and continue to make you aware of other opportunities to participate in other types of research.
That is fantastic. So just, clinical trials, when we hear those terms, right? We hear that term, and I'm going to address the elephant in the room. A lot of times, especially people of color, tend to take a step back. We hear clinical trials, and our mind goes directly to, Tuskegee, Henrietta Lacks, all of the stuff. Dr. Spencer, when you hear that pushback from in a general sense, how do you respond to say, okay, how do you respond to somebody that says, I'm not getting on clinical trials, they're not taking me, they're not putting anything in my body? How do you respond to that person?
Yeah, I'm glad you asked that question. You see, I already unmuted myself because I was like, look, I need to weigh in on this, because I would get calls in my clinic from patients that will say, hey, they contacted me about this trial. Is this safe? And should I do it? They're very suspicious of anyone contacting them about being asked to be involved in clinical trials. And so I always like to say, listen, we have, because of the sacrificial lambs of people like Henrietta Lacks and Tuskegee, institutional review boards. And just to those that may not know what that is, it's just an oversight committee. It's a community of professionals that make sure that everything is completely transparent, that you sign an informed consent, you're completely aware of why you're there, what's going to happen during the study. They have site coordinators that are responsible for documenting and making sure that they report any adverse events. They have oversight to shut studies down if things are steering in a direction that shows that, hey, this drug is not as safe as we would like, or not as effective as we would like, or side effects of the risk don't outweigh the benefit. So I like to have the conversation first and foremost by saying it is because of those misdeeds that we oftentimes don't want to talk about that we have very strict criteria when we are conducting clinical research. And it's like the benefit of how many millions and millions of people it could potentially help is just of paramount importance. So we just have to address the elephant in the room, just let them know that there is definitely oversight now, and that it is a very safe environment, a very transparent environment, and to thank them in advance for their contribution to science. And then also reassure them that when you're doing a clinical trial, it's not always getting medication. Oftentimes it could be observation. Sometimes it could be filling out a survey. Sometimes you may not even need to come in. And the good thing is, with sites like CVS and their minute clinics, you can have the convenience of going in right to your neighborhood on a weekend, a Saturday or Sunday after church, to get involved with the clinical trials. But let them know, listen, we are not going to expose you to anything that's going to be unsafe. We first do no harm. So just let them know how important it is to gather the information by participating, but it's safe. And there are so many measures in place now because of those awful things that happened in the past that didn't give people informed consent, and we weren't as transparent as we should have been in these vulnerable communities of color, or just communities in general that aren't aren't protected. And so we have these things in place. So again, that is the main thing, is just to make sure they understand that there's a system in place to protect them. And that's our number one priority.
You know, and I would, if I can add to that, right? So there's certainly things that have happened historically, but people of color, you know, have everyday abuses that happen in the healthcare system, right? So this lack of trust isn't just about what's happened in the past, but it's really the healthcare system being trustworthy, right? So we are certainly confronting that. And one of the good things, if you look at, you know, the folks on this Facebook Live, is that, you know, if we think through the BlackDoctors.org community, you know, this is our community, right? So these are our friends, our family. This is us, and so we have the physicians on the call are part of the research, and are conducting the research, right? So for us, it's not just an academic thing. It is really, when we see people, we see our parents, we see ourselves, we see our kids, and that, in addition to these structured ways of protecting people, I think is one of the things that's changed dramatically over the last 20, 30 years.
Absolutely. I think that is well said. I mean, you're absolutely right. And I think the other piece that we have to recognize when we have clinical trials is you are getting some of the best care, right? Because you're going to be monitored if especially if it's something that if they're trying to develop a new medication, you're going to be monitored. You're going to get care, and all of this is at no charge to you as the end user. And Dr. Garrett, you mentioned some of the innovative things that CVS was doing in terms of like ride sharing, being open on the weekends. So now it is becoming more convenient and accessible. That's a big word. Accessible for communities of color to become more involved. And we say here at Black Doctor all the time, involvement improves outcomes, and that's what we're trying to do: get more people involved to improve the outcomes with regards to any type of illness. But tonight we're talking about CMV. So.
And Allison, the next stage of that, right, is also, if the research staff is part of the community, they begin to know and understand what are the research questions that are important for the community. So, right, as we draft and build protocols, which are really the guidebooks to the research we're doing, we begin to ask research questions that are relevant to our community. And as you do that, you get even more buy-in, right? Because they realized, that actually makes sense. That could potentially help me, you know, versus oftentimes you sort of have research that comes down from the ivory tower and we are asked to participate. The way we're thinking about it is, if you're truly part of the community is helping you design the research study and telling you what research would be relevant for them.
That's good information. That's good to know. So what can somebody expect when they come into the clinical trial? If they present, can they, I know there's a website, can they walk into a CMV and ask about this trial? Can they go to the Minute Clinic? What can they do if they are not internet savvy enough? Most of us now, especially now, if you're childbearing age, you should be internet savvy. Y'all grew up with a phone. I think my child was born with a phone in his hand. But in those instances, can they walk in and just say, "Hey, I heard about this CMV trial. Can you give me more information?"
Yes. So if you actually walk into one of the locations that are conducting the study, you'll most likely have someone there that can answer those questions. If not, you can be referred to either the site or a call center and given the opportunity to ask those questions. The other part, and learn more. The experience is, let's say you're determined, it's determined that you would qualify. You would then go through what's called an informed consent process. So the informed part is you learn about all that's required, the number of study visits, how long the trial is going to be, the risks of participating. You know, these are still unapproved therapies, so we don't know everything that can go that can work or not work. We do have a fair amount of information because this is what's called a phase 3 study. So the first and the second phases have already happened. So we have a good sense of the risks, but not a complete sense of the risks. So, and you even you see sometimes when even a drug comes to market, you learn more about it, because it's one thing for it to be studied in even 10, 20,000 people when millions of Americans or hundreds of millions of people have a drug worldwide, have access to it. You begin to see even more things that could be, that would be viewed as risk and what we call side effects. So you get that information. That's the informed part. And the consent part is that you actually agree to participate and are willing to participate. The beauty of informed consent is that you can withdraw your consent at any time for any reason. You won't be asked. You might be asked for, to help improve the study for other folks, but you can withdraw and stop participating at any time that you want. And there's no harm, no retribution. No one's going to come after you for any reason. So that is what would happen once you begin to participate. You'll have a sense of, like I mentioned, the number of study visits. And at the end of the day, what we're looking to see is, does this vaccine work, right? And there are two broad components, right? Do you develop enough antibodies? And the antibodies are the things that fight the infection. And then two, does it prevent? I mean, you do that, if you draw someone's blood, you can, in essence, count the number of antibodies that are actually in the blood. And then the second thing is, does it prevent infection? So you work with people and test them over a couple years to see if they actually don't get CMV. So that gives you a sense that the vaccine is actually working.
I think what we have to do at this point, especially as we're coming, closer to the end of the hour, is we have to remind people that CMV is out there. We talked about it at the top of the program, the impact it can have on adults, particularly, and the impact it can have on unborn children. Dr. Monique did a fantastic job of talking about at what point, if it's congenital CMV, if it's a mother that's having a child, is carrying a child, if that child develops CMV, and there's different types, right? Into early first to second trimester versus late term CMV. So there are all these things. But the beautiful thing is what this trial is trying to do is trying to develop some medications, some treatments that can help prevent that from happening. So we're trying to, and you can go into CVS, which is really there locally. So you don't have to go to a university center where they used to do all the clinical trials. You have to run up to the university, or you have to go down to the big hospital to go to the clinical trials. We don't have to do that anymore. You can go right there in your neighborhood. You can go on Sunday with your good book and your Pepsi Cola, and you can get there right there at CVS. You get food right there at CVS, get something to eat, participate in the trial, and go home. So it's a lot more convenient. You can get a ride if you need one. So they have really thought about trying to make sure to make participation as easy as possible for you. And so that's what I appreciate, because we recognize the importance of these trials, particularly for women of color. There is a question from one of our viewers. It says, have any of the doctors here participated on the panel as a principal investigator for a clinical trial, or has anyone in your professional network acted as a investigator for a clinical trial?
Yeah, I have participated as the principal investigator of numerous clinical trials. More recently, looking at hot flashes in women and tried to develop an effective drug for hot flashes, either during perimenopause or hot flashes that oftentimes women will get during their treatment for breast cancer when they aren't estrogen blocking medication. And again, I love what CVS is doing by putting them in the neighborhoods, because when you're a principal investigator, you usually have to go to the university or a site that may not be near your clinic or near your hospital. And so I'm hoping that will also help increase participation of physicians and scientists in the network, in the neighborhood, so that it'll be accessible for the principal investigator as well. Because it sounds like CVS is very committed to making sure things are convenient, not only for the study participants, but also in recruiting quality principal investigators that are a reflection of the community that they're servicing.
And Dr. Spence, that's a great point, right? So we engage with what we call community physicians. So you don't have to be part of an academic medical center. So yes, if you are practicing in the community, you can continue with your practice and also serve as a principal investigator in our studies.
Anybody else have anybody in that network or participated as a principal or a site investigator?
Yeah, and certainly I've done, a little bit of both, PI and then also as a community provider, helping out in studies. And certainly lots of folks that we know who are, maybe, that's their primary, responsibility. For me, I'm primarily in the clinic seeing babies and teenagers. But it's important that, we get involved in research, that we know these studies so that we can refer our families. But certainly we do have, good experience being involved in research ourselves, which I think is always, a fundamental of, medical education.
Fantastic. So Faith, I hope that answers your question. There are people of color that are on these, and we're getting more and more getting trained to be principal investigators, to be site investigators, to add that additional level of control. We've got the IRB, which is a review board. We've got the informed consent as a result of what's happened in the past. Where as we're moving forward, we're getting more and more people of color involved. And as you can see, what CVS is doing, they're going to the community. They're bringing the clinical trials to the community instead of forcing the community to come to the clinical trials. They're bringing the clinical trials to you. And so that we're eliminating excuses. There's no excuses. And I have to be remiss because I live in Atlanta. And I said Pepsi Cola, woo, Coca-Cola. We drink Coke at the South. I'm sorry. I know. I'm about to have somebody knocking on my door right now. Did you say Pepsi in Atlanta? Can't say that here in Atlanta. So I'm sorry. You have to say Coke. We say Coke here in Atlanta.
That's right.
So as we're wrapping up, we want to make sure that what we want people to know. So as we're going to go around, and the last thing we're going to do is we're going to talk to everybody and say, what's your final thoughts with regards to this? I think what we've learned, as I said at the top of the program, what are we going to learn tonight? First thing we learned is what is CMV, right? We learned what CMV is in adults and what it happens in congestital CMV for women that are trying to have children. We learn what it does to the body, right? And so we're like, this virus has been around. It's not new. It's not like COVID. It's not a new virus, but there's not a tremendous amount of therapies, particularly for this group that we're talking about, women that are childbearing age that want to have children. So this is what this clinical trial is about. We also learned that CVS is already engaging in the community. They are putting it in their stores. So if you are in the Atlanta metro area or Savannah, please go to your local CVS, go to the website. We put that in the comments. You can click on that and just go learn more about it. We talk about it here for an hour. You can go learn more about it. So that's what we're learning tonight. And again, if you know somebody that is of childbearing age, especially a woman of color that is not pregnant currently, send them in because we need to get that data, right? Even if they don't, even if they get excluded from participating in this trial, the fact that they tried, the fact that they presented is going to go a long way to keep CVS and keep companies putting those trial centers in our community to make it convenient for us. So we've got to say, hey, this is important to us, and we're going to be here and we're going to support the companies that are supporting us here locally in our community. So that's what I've learned tonight. So we're going to go around the room as we're wrapping up here. Anybody get some final thoughts? Dr. Mini, we'll start with you. And I like the way you just got the name like Madonna, you like Beyonce, I am Monique. That's it. That's so good.
That's what they call me, so that's what I go with. Thank you so much for having me in this meeting. I really appreciate it because as an OB-GYN advocate for women's healthcare, we definitely need more representation in the clinical trials. And I love how you reiterate prior to pregnancy, because we love for our patients to be involved in that and be able to come up with a better form of treatment and prevention for CMV and other viruses as well. So definitely we'll be talking to my patients more and more about becoming involved in clinical trials and helping to, somewhat eradicate the disparities that we have been a part of in history.
Absolutely. What's the cliche? An ounce of prevention is worth a pound of cure. Dr. Brown.
Yeah, thank you so much for, having all of us. It's such an important topic. And I would say, talk to your doctors, make sure that you spread this information, because the more we know, the better that we can do. And so learn about the trial. Even if you decide not to participate, at least get the information, because ultimately you're the one who will make that decision. And don't be afraid to ask your questions.
Self-advocacy. That's very, very important. Dr. Spencer.
Yeah, again, thanks for having all of us. And I just want to encourage those that have taken the time out of their busy afternoon to spend this time with us and engage in this conversation of raising awareness of CMV, but also the importance of clinical trials. But I really want to implore everyone watching to go from awareness to action. Like, what are you going to do about it? And I'm hoping that we gave you some tools, some actionable points, such as talking to your physician, talking to your family members and your friends, those that are thinking about getting pregnant. And even if it's not a conversation about CMV, but just the importance of getting back in the driver's seat of your health and using this awareness to act when you go to your doctor's visits to inquire about clinical trials and if you would qualify for any of them. And as it relates to CMV, I think it's applicable. We say this in breast cancer all the time, but early detection means better protection. And I think that applies for CMV as well. So we get early detection, we will have better protection in terms of lowering the disparities and decreasing the morbidity and the mortality of this very deadly but preventable and treatable disease. So thanks to CVS as well for helping be a partner in that.
Absolutely. And Dr. Garrett.
Well, first, I'd just like to thank Dr. Spencer, Dr. Brown, Dr. Monique for taking time out of their busy schedules to help us spread this word, not just about the CM Victory study, but also just about clinical trials generally and the work we're doing at CVS. And Ellis, I got to introduce you to our marketing team, man, because you're doing it. You are. I'm like writing down some catchphrases now that I'll have to pay you for later, but I got to introduce you to those folks. And for the audience, one of the things you can do is, let's say you have, I'm making this up, diabetes, when at your next checkup, ask your doctor, are there diabetes studies that I might qualify for? So very simple, if you have something going on, just someone, something, that a family member is dealing with from a health issue, just ask that question. And I think that will help the medical community know that people of color are in fact interested in clinical trials, and they should begin to proactively ask us versus us always having to sort of seek out information or not be asked.
Absolutely. Absolutely. Well, I want to, on behalf of BlackDoctor.org, I want to thank CVS Health Clinical Trial Services for partnering with us, because, we have a concerted initiative to get involved and get more people of color involved in clinical trials. We have our Clinical Trials Resource Center on BlackDoctor.org, and we're going to be talking more and more about clinical trials programs and what's available to you. So thank you so much for everybody for your participating here tonight. Thank you all for watching so much this evening, learning about CMV. You learn something new. Like I told you, there's 2,000 programs, 9.5 million people reached, and we did not do one show CMV. So now we have cracked the label of CMV, and we're going to keep it going. As they said in New Jack City, CMV, we all we got. We all we need. That's who we are. And we want to thank you all for joining us this evening. This has been fantastic. We will see you next time. Go to your CVS. Get involved. You cannot change things if you are not rolling up your sleeves and getting involved. Thank you all, and we will see you next time.